Hi, my name is Isoslanda and welcome to the Histo-PathGuy. Today we're looking at the large bowel, and should be fairly simple for you to identify large bowel and be able to differentiate it from small bowel. So let's just quickly go through this. Remember that in the intestines, including which is also the large bowel, there is a mucosa, muscularis mucosa, submucosa, and muscularis propria. And then this here, which you're seeing, is just probably a piece of mesentery which attaches to the large bowel. You can even see there's blood vessels there. Anyway, let's have a look at the mucosa. So in the mucosa, we've got a lot of goblet cells with columnar epithelium. So remember, the epithelium is more basally located and with abundant goblet cells. The reason for this is, remember, the goblet cells produce a lot of mucus that can lubricate the feces as they go down the bowel. And remember, as the feces are going down the bowel, these epithelial cells, which are of simple columna, absorb water, making the stool more concentrated and hard, and the goblet cells produce mucus to lubricate that to prevent injury. But now look at the lamina propria. So the lamina propria also contains quite a number of inflammatory cells. This is good because you can actually see that these immune cells protect against infectious pathogens that are harmful to us. So another thing to note is, look, this forming like test tubes or like crypts. Can you see they kind of form like test tubes here? It's another way to kind of remember, okay, I'm in the large bowel, like test tube appearance. And then as we get deep to the mucosa, we have muscularis mucosa, which consists of smooth muscle cells, and it's quite thick because remember, it's vigorous. It's trying to move this big stuff down, kind of down the drain to the anal region. And then deep to the mucosa, the muscularis mucosa, we've got the submucosa, and we also get immune cells. You can see here is a lymphoid follicle here. This is quite normal. It's good for us because it protects us. And now, and you can see it's quite almost, can you say, cellular in this section, but you can see quite a lot of connective tissue here. And then deep to the submucosa, we've got the muscularis proper, which is also quite thick. Remember, you've got your inner circular muscles and outer longitudinal muscles, or is it, oh sorry, outer circular muscles and inner longitudinal muscles. And remember, there is nerve in between them. This is nerve tissue here that we can see, probably part of the myenteric plexus, which is autonomic, that helps with peristalsis. So that's about the colon. There's nothing much here really in terms of normal histology that can throw you off. Just remember, it is also what we call tinea coli, which are 3 bands of muscular fibers that also help with propelling, and I think here this is one of them which I just showed you. Here's a blood vessel here. There is another blood vessel there. Yeah. Oh, here's another immune follicle here, which is helpful. So maybe I can just leave you. I'll just peruse through this here slowly so that you guys can see the beauty of the large bowel. Okay, there's an immune cell here. So the submucosa is quite protective with immune cells. with intestinal crypts there, which I showed you. Blood vessels here. Can get to the mesentery, which is also just fat, adipose tissue. All this here is adipose tissue here. Let me zoom in for you. You can see these adipocytes there. Because remember, the mesentery is quite vascular. It takes the blood supply to the colon so that it's still alive and can do its function. And very, very fatty. If you have any questions, please feel free to ask in the comments, or if you want any clarifications, post them in the comments, and like and subscribe, please. More videos will keep coming out. And if you want to revise your normal histology and compare this with the small bowel, have a look at the other videos. Thank you very much.